All right, so what is going on, people? How we doing? Welcome back, episode 2 with a ProMet Physical Therapy and Kinetic Remedy podcast, trying to help aunts, uncles, mom and pops, and just the regular folks, as well as athletes, heal themselves and their body, provide them with some understanding. Um, Today's episode, we'll be focusing on foam rolling, trigger pointing, and myofascial release, and what those things are, and Antonio will break it all down for you. So my first question is trigger pointing. No, myofascial release. What is myo? What is fascia? What is that exactly?
Okay. So myo is just a Latin term for muscle, and fascia is just the connective tissue that surrounds your muscle. So myofascial is just the combination of the whole muscle system, kind of. So it's the muscle and the fascia together as one unit, and that's throughout our body. So our muscles obviously are all over. They surround our joints. But not only, just like when you kind of, it sounds weird, but when you buy like when you buy like a chicken breast or something like that, and there's this like layer, this thin layer of white film that's above the meat of the chicken, that's the fascia that surrounds our muscles. And it's really not like it doesn't have contractile type of texture like a muscle does. A muscle is more, more pliable, elastic. You can kind of stretch it, and it's a little more of a different type of feeling. The fascia is more just kind of like, a tight piece of saran wrap around the muscle, and it's there just to help us kind of walk, stay up tall, and just connect our whole body and keep a nice rigid stature. So that's what myofascial kind of stands for. Now, in terms of trigger points and what myofascial releases and some of this stuff, I would say trigger point. First of all, so when you're looking at a muscle belly, right? The center of the muscle. So like say I'm looking at my thumb muscle, right, from here to here. Usually right in the center of it is where what we call the motor end plate sits. So obviously our nerves need to fire and they contract our muscles.
Mm-hmm.
So when most of our nerves, they exit in the middle of our muscles. So if you look at your thigh, it's usually in the middle. Somewhere in the middle, you might get a little bit of a tender spot. Your
Mm-hmm.
upper trap muscle, not really up here, but sometimes like right at the base in the middle of your upper trap is where some people have those trigger points. So that's
Mm-hmm.
the area that the trigger point is kind of more active, because that's where the nerves are entering and trying to contract the muscle in that area. So what happens is, say you have 100 muscle fibers in the upper trap muscle, and the upper trap it helps us shrug up, it helps us kind of reach up, it elevates our shoulder a little bit up. So say you have 100 muscle fibers, and there say 40 of them are kind of in this trigger point area. 40 of them are kind of all spasmed up, and say over time through age, getting older, more activity, sitting longer periods,
Mm-hmm.
overuse, whatever it may be. This say this trigger point here now, before it might have been only 20 muscle fibers, now it reached 40 muscle fibers. So now out of our whole 100 muscle fibers, we only have really 60 that are working, because 40 are just kind of in this tight little spasm that are right in the center of the muscle. So what do? Well, we got to identify that first. We got to make sure that it truly is coming from a trigger point.
Mm-hmm.
We got to make sure that it isn't, there is no kind of bony sort of structure issue going on. There's no fracture, no, obviously no like strain in the muscle. Once we kind of tease those things out, then we can kind of attack this trigger point with either just a active release type of technique where we kind of use our hands. We can use tools. You can use foam roll. You can use a lacrosse ball. I think it's better when you have someone who uses their hands, because they're going to be able to kind of really feel a little bit better. They'll get more local.
Mm-hmm.
Like when you see a physical therapist, they're really targeting kind of and getting a little more specific. So using the hands is always kind of the gold standard. But definitely, making use of other equipment that you have to mimic the same thing is definitely definitely helps.
Yeah, absolutely. Agree. So one of the things that I hear differing opinions about is for me personally, I like to trigger point as well as foam roll, but there's a lot of information in both directions that no, foam rolling is no good, and that you should only trigger point your body. And to me, it's like I see where and why some people say things in each direction, but for my personal body, I think of it in comparison to sort of a dynamic and active warm up. It's like you need both. One isn't just, well, for my personal body, one isn't better than the other. So I like to go into a foam roll just to sort of loosen up the fascia, so to speak. And then if I do have a tender spot, I'm going to go and trigger point that and try to really get into it and release. But some people will actually go into scientific sort of support and say, no, foam rolling isn't good for you, that you should only be trigger pointing. What are your thoughts on that?
Yeah, I think it comes to the point where, um, see, I mean, a lot of the time, we created all these foam rollers, right? It started with a simple just foam roll, right? Then
Mm-hmm.
it turned into, a foam roll with edges on it. Then it turned into a foam roll with vibrating. Is it now it vibrates? Then it turned into different shapes, right? So it's like, if the foam rolling was working and if that was doing the right thing, why do we have to continue to modify it, several times? You know what I mean? So it's like,
Mm-hmm.
the first modification of the foam roll kind of should have been, okay, well, this is, that should help. It doesn't, there's just by it having more edges, or, that it vibrates, or it's just all these other things that just kind of make it feel good and make you feel a little bit better. But it's been doing the same thing since, the first time a foam roll was ever created. It's what it does is it just changes your sensory system. It gives your brain a little feedback and says, hey, we have a tight little muscle. This is the area that I feel it. By putting a lacrosse ball or a foam roll on that area, you now are perceiving kind of a relief. It's just a perception change. It's a lot of just it's really based off of like your sensory system. So now
Mm-hmm.
your sensory system feels a change, feels kind of a relief. Your brain says, oh, there's something going on here, that it kind of desensitized, which means it kind of it doesn't make it as sensitive. To keep it easy, it's not as sensitive when you put something on there, which makes the brain kind of appreciate that, and now it becomes familiar. The brain's like, oh, okay, I remember I have a pec now. I remember I have those muscles.
Mm-hmm.
And then that creates a window of opportunity. So what is a window of opportunity? A window of opportunity is often what we miss. We often just, hop on the foam roll, or hop on the lacrosse ball, and then go back to working, or, go back to whatever it was that you were doing.
Mm-hmm.
What we like to do is use that window of opportunity that just decreased your symptoms a little bit, increase some range of motion, maybe got some blood flow in there. Now your brain's thinking, okay, wait a minute, I got a muscle, I feel it, it feels good. Create that without that window of opportunity is an area where now you can start strengthening. You can start doing a little, a quick little reset where maybe you take a band and you're doing some of these afterwards. Maybe you're doing some breathing and reaching. Maybe you're doing, whatever it is. Maybe you get into, a little sit to stand, a squat. If you foam roll your hips. But it's always good to do that first, the foam roll and all that. Create a little window of opportunity for you to now strengthen and re-educate your muscles to say, hey, muscles, this is how you're supposed to work. I want you to feel it
Absolutely.
in the actual muscle.
Absolutely. So now let's say if uh, working with athletes as you do, a lot of times they know how to activate their body before exercise. I see some people just sort of, I'm going to touch the toes 3 times and I'm going to hit the treadmill running, and then at the end of the week they're like, oh man, this is killing me. This is killing me. So what is the difference between, first, what are you doing first to warm up? And as far as stretching, which I kind of jumped the gun on that, is there a difference between static and dynamic stretching? And how would you prepare using myofascial release, static and dynamic stretching prior to exercise?
Yeah, absolutely. So that's a great question. And one that gets overlooked. A lot of our clients and patients and a lot of your clients, I'm sure they kind of just, a lot of people are in a rush. They just kind of they get to the gym, and then, I mean, they only have an hour, you know what I mean? So they can't stretch for 10, 15 minutes. They got to get right after it. So, obviously it's a priority to, if you want to, emphasizing that if you want to continue and you love working out and you want that, got to think about longevity. You got to think about what you're doing today to prepare yourself for the workout. And so you can do this for a really long time. So yeah, so prioritizing your warm up is huge, right? And organizing that is important, because it's like, what the hell do I do as a warm up, right? I thought the treadmill was a warm up. I thought I warmed up on the bike. Isn't that enough? Isn't that enough, right? You know what I mean? So it's like, so I think there is things that you want to target, and I would say you want to start with almost like some sort of foam roll, maybe some sort of soft tissue work, where it's like you just kind of like, you're just warming up, you're just loosening up the muscle a little bit. Then after that, you can get into some static stretching. Static stretching is just kind of just holding a position 30 seconds, 3 times, whatever, 30, it's holding a position for a prolonged period of time. There's really no dynamic activity, although I like to incorporate kind of like a little bit of a core, kind of a feeling in the core as I'm stretching something, because it is important to kind of hold one down as you're moving the other. So you have to kind of create stiffness somewhere to get the benefit of the stretch.
Leverage, yes, sir.
Yes. So I always, even though it's static, there's always a active component of either the core or something else that I'm trying to incorporate to statically stretch. So say you're stretching out your hamstrings, a basic hamstring stretch, laying down on the floor, I'm not just going to want to reach. I'm going to want to exhale, kind of almost do like a mini crunch in my core, keep my core activated as now I could reach my toes. So that's static stretch, but again, active because I'm keeping my core tight. Then I would go, so from lacrosse ball or foam roll to static stretching of specific joints. If you mentioned to Susie, hey, I want your hamstrings are a little tight, or your hip flexors are a little tight, I want you to spend a little more time. That's where you would do your static stretching. It's not, you're not going to static stretch every joint, but the ones that you see are important. I would say the hip flexors, I mean, we're all sitting, so I would say that's an area we want to statically stretch, maybe 30 seconds 5 times, something like that. Again, keeping that core kind of crunched down, because a lot of people just fly out into extension and just overarch. So that's one. I would say, our pecs get pretty tight from, again, sitting and rounding. So going against the doorknob, holding that kind of wall stretch, doing it at various angles. That's another one. And then, yeah, so then I would take those, and then now we go into a dynamic where now it's more of a flow. Maybe we go into a downward dog, right? Then we go into kind of like the world's greatest stretch. I'm sure you're familiar, where you kind of now bring one foot in front of you, you maybe open up your spine a little bit, you come back up. Now you go into a hip stretch, and then you come back out of it. And then maybe you do some, maybe you do some side steps with a band, right? Maybe you do some shoulder cars, right? Where you just are controlling your shoulder motion against the wall, getting that nice ER, IR. So that's more movement. That's more now I'm moving as I'm stretching. So it's combining both worlds, getting you ready for jumping, which is great. It's getting you ready for jumping. If you do static stretching too much before jumping, it's actually going to decrease performance. So we don't want to do static, right before we're doing our jumping routines, because it's going to kind of hinder performance a little bit. So definitely, that's something static I would do maybe like after a workout, or, after a performance. I wouldn't do static before, a boxing match or something like that.
Yeah.
So
Nice.
yeah, so dynamic is great though, because now you're warmed up better. You've moved your joints. You're teaching your body kind of how to loosen up. And again, you're spending maybe, spend 5-10 minutes, at least 10 minutes of just warming up before you're going to get into it. And then now you kind of work your way to, what your program or whatever your goal is for that day.
Yeah. I like to tell my clients that I want them to sort of have a decent sort of sweat on them, a nice little film, like your body your body temperature's up, your heart rate is pumped, all of your muscles are loose, you're activated. You should have a bit of a sweat on you after your foam roll, after your dynamic stretch and warm up, and that will prepare you for your activity. Now your body is really ready to go. But one of the things that I want my clients and regular folks, my family, my aunts, my uncles, my mom, to understand is these things aren't, you don't have to always do one thing. What do you think about that? Like doing one thing always consistently. I want to learn to teach them. I want them to teach them to learn to utilize all of these different forms according to how they feel that day and apply it in that way. What do you think about that in terms of staying structured, regimented within this same sort of pattern, as opposed to just being more loose and feeling your body out? What do you think about that as well?
I mean, I think there is a benefit to structure. I think there is a huge I think
Absolutely.
there's a huge component of exercise and stretching and health and wellness. I think there's a lot of confusion in health and fitness, and nobody knows really. It's hard to navigate. It's very gray. There's not too much. Nowadays, I think health and fitness is building up, getting a little bit more popular. I mean, it has been for the past 10, 15 years. I think it's picking up steam, and I think it's continuing, but it's definitely very confusing, and it's definitely challenging. So I think the benefit is in your sequencing and how you're programming it out. So I would say, yeah, I think it is important to stick to a plan. I would say it's probably it's always good to listen to your body, number one. I mean, you have to, if you're just not feeling it that day, and or you're feeling a little loose or whatever. And but I still think it's important to follow a plan, to follow a structured plan that you're going to do, almost every time you're working out, every time you're about to do your workout, every time you almost at least 4 or 5 times a week, like just as a just a warm-up stretch or whatever, because that's going to build a habit. That's going to just enforce good control, and it's just going to teach you kind of to stay disciplined to something, and stay consistent to that. Because we all see, if things are kind of out of control, and you're not really focused on what you're doing that day, and you're like, you know what, I think I'll do legs tomorrow, or like, it's like, today, you know what, I haven't hit back in a while, let me hit back today. It becomes like, it becomes, now you gotta, like, be on the spot. You gotta think of exercise on the spot, and stretches on the spot, and all those things. And you might get away for a month or 2 months, but that's going to get old, and you're going to notice that you're not really, you're kind of just staying where you're at, and you're not really improving or anything, and you might just be plateauing. But hey, if that's your goal, and you just want to maintain your health, and you just want to maintain things, and you don't really you know have time to be planning it out and whatnot, then by all means, just keep it maintained, and base it off how you feel. But don't take your body for granted. Don't take the way you feel for granted. If you're
Hmm.
feeling good and you're feeling loose, that doesn't mean you shouldn't still do your dynamic warm up, still do your myofascial release,
Yeah.
and get into it, because the best time to do it is when you're feeling good.
Yeah.
I believe
Absolutely.
that. I believe that it's important to stay on a little structured plan, and just create it yourself. Really, just get a feel. Reach out to one of us. We can help you plan it out. We can help plan out your myofascial stuff, your warm up, and into your exercise routine. And you don't have to do any thinking. But it is important to follow a structured plan. And again, maybe you're following it for 2 months, and then you switch it up or whatever.
Yes. Yes.
But again, you're just making sure that you're staying true to yourself, and
Hmm.
you're creating a habit, which I think that's the biggest thing.
Yeah, no, I agree with all of that. I don't want to disagree that I don't believe in a pattern. You definitely believe in a pattern, and you're touching on programming, which is leading into our next segment coming up in about a week or two.
Yeah.
But my thing is I have clients who they've done certain things consistently over time that have led to their injuries and led to their issues. And so I want to let them know, like, hey, yes, because we always have to keep a consistent form, right? Keep a formula. And then from that formula, we could deviate a little bit and create this balance within our body. But they've hurt themselves doing the same thing over and over. Now they're with me and I'm like, hey, let's try this instead. But they're like, no, but this is what I've always been doing. So that's where I was more leading to, is in terms of to even what initiated this, the foam rolling and
Yeah.
all of that, accumulative injuries and what happens to the tissue when you do the same thing over and over, and the pattern overload on the muscle. And how is it that we tie in what we were talking about in regarding the myofascial release, the trigger pointing, and releasing those sort of pattern overloads and accumulative injuries?
Right. Yeah, absolutely. I think, at a conflict and, somebody's used to doing something for so long, yet they're coming to you for a reason. They're talking to you, they're bringing up these problems, and, if they're still not kind of trying to fix their stuff, sometimes I just say, hey, I'm sensing that you're not open to change. I'm sensing that, we're not really getting to the next level here. What can I do to, assist you there? Because a lot of, through the evolution of mankind, it takes a lot of being open to changes to kind of have a breakthrough. It's you can't just be doing the same thing expecting different results, right? Isn't that like the definition of insanity, right? Like doing the
Mhm.
same thing expecting different results. So it's like,
Yeah.
those are the things that I try to bring up to people, and they say, hey, listen, you're taking the right step. You're here with me now, right? You're taking the right step. You want to get better. You're trying to improve. You're trying to go on vacation with your family and go on hikes and stuff like that. Those things are important. However, you're telling me that you've been doing this thing so much for the past 5 years, and it's hard for you to change. And I think that's exactly our plan of care here, is making sure that you are able to transition to something different in a safe manner gradually, so that it helps with your goals and helps you get to where you need to be. So I think it's just having that conversation with them, and just making sure that they're also on board with some of those changes that might occur, and just letting them know that, listen, it's to have breakthroughs and to continue to get better. You're going to have to meet your body where it's at, and as we get older, our body changes. So what
Yes.
I was doing 5 years ago, it's probably not what I'm going to be doing now. You know what I mean? So it's like, that's the conversation we need to have. And obviously, that conversation isn't brought up a lot. When you go to your primary care, when you go to, your orthopedic, unfortunately, they only have about, 10-15 minutes with each patient. So and, uh, personal training and all that stuff is some people don't have time for that as well. So they don't get the education on these proper ways to go about things, and about gradually improving, over time, and what to incorporate and what is best for your body. And, the education on that is just not there. So it's, again, you can't expect them to know that. It's not their job to know that.
Mhm.
So, it's up to us to continue that education and say, hey, there is another way to do this. There is a more optimal way to do this, because as you're aging, things are changing at a pretty significant rate. Things are declining, and that's just a part of life. That's just what happens. So we have to now take even extra care of our body as we age. And some of those topics, now it starts kind of sheds a light to people, and now they start to realize, okay, if I want to do these things and go on hikes and spend time with my family and do all these things, I got to start looking at how I can maintain my health for a long period of time.
Yeah, absolutely, man. Absolutely. I think you just hit everything on the head. I think that's the biggest reason why I was so excited to do this, was to help to provide those insights for the
Yeah.
people. Because, like you said, oftentimes those individuals are spending 15 minutes with their doctor, chiropractor, whoever, wherever they are going to help their body, and they don't have it. That's just the surface sort of coverage to their health. But having the knowledge yourself allows you to sort of heal yourself a little bit, and you're doing exactly that, passing on this knowledge and this information. So absolutely, I want to say thank you again
Well,
today. That was a beautiful job. Anyone who's watching this, if you have any questions regarding the muscles, the tissue, myofascial release, stretching, and foam rolling, please DM at Promet PT or at the Boxing Doc, correct?
Yes.
And as well as Kinetic Remedy, and we can sort of help you with those sort of answer your questions, and also stay up to date because next week we will be touching on oxygen regulation, breathing, and what that does for the body. And yeah, absolutely.
No,
So, do you have anything else to close with?
absolutely. No. Yeah, of course. Just continue to let's continue to ask questions, get the word out, get in front of these people, and just, it's the land of mediocrity sometimes. And, we have to we have to be at the forefront and, get these conversations out there and just, make sure people are getting what they need. I mean, it's tough because it's me and you right now, and it's just, us talking. It's hard. We can't just put a billboard out in Times Square and say, hey, this is what it's about. Learn the why. Why are you in this? And talking about those things. So continuing to do this is our billboard and just building that up. So just for everyone watching, just continue to share this because this is important stuff. And the people need to hear this stuff and to get to where they need to be. This is stuff that's going to kind of change who they are and for the better, and make things realize that, hey, the details do matter. Details do matter. And your trainer, your healthcare provider, they need to be looking at those things. So share, like, comment, please share with someone. If you found this helpful, please do your due diligence as a way of paying it forward for us.
Yes.
By just sharing with one person, family member, friends, whoever you want to. But please, thank you, and pass it along.
Yes, sir. Share, like, subscribe. Everyone, have a great day. Be safe.
Awesome. Thank you.
Thank you, Anthony.
I'll see you soon.
All right, brother.